Millions of Americans had the opportunity to make changes to their Medicare coverage last fall, but being proactive about Medicare coverage doesn't end once the annual enrollment period is over. In fact, now is the time for people to make more important decisions that can impact not only their health, but also their wallet. Joining us now to share some tips is Market CEO for United Healthcare, Medicare, and Retirement, Mary Snyder. Thank you so much for talking with me today.
Hi, thanks so much for having me.
Absolutely. Now, what should people keep in mind when it comes to their plan's coverage, especially during the pandemic?
Yeah, I mean, the COVID-19 pandemic has profoundly changed the healthcare landscape, and it's just reinforced the need for people to take good care of their health, both their physical health and their mental health. Medicare coverage is designed to ensure people can get that care they need, whether in a healthcare setting or, more importantly, even now at home, too. And everyone enrolled in Medicare has coverage for preventive services like an annual wellness visit and certain cancer screenings. And it's so essential not to put off that preventive care. It can help catch and treat problems early and help them from potentially becoming more serious and even more costly. The other thing important to realize, though, is that Medicare Advantage plans in particular offer benefits and features that are not covered under original Medicare. Things like dental health and vision, dental hearing and vision coverage, as well as fitness benefits. They're really great added features and they're cost saving too.
That is fantastic. And can you share some tips on managing healthcare costs?
Yeah, of course. So original Medicare covers 80% of Part B medical expenses. Those are doctor visits and outpatient services. And there's no limit on what you might have to spend, and there's no prescription drug coverage. Medicare Advantage plans offer predictable copays, and there's a cap on that out-of-pocket expense you might incur. So if you hit that, everything else is covered 100%. And Medicare Advantage plans are also typically bundled with Part D plans, which give you prescription drug coverage. So that's a great way to start. And then those other extra features, like I mentioned, they can be expensive. Dental, vision, eyeglasses, hearing aids. None of that's covered under original Medicare, but Medicare Advantage plans often do cover them. So those are some great ways you can save money.
And how are health providers making it more convenient for members to get the care they need?
Yeah, I mean, one of the biggest ways that's come out from the pandemic has been telehealth. Most health plans are covering virtual visits, both physical and mental health virtual visits. So that's a great way. There's another program I like to talk about, though, which is called House Calls. United Healthcare Medicare Advantage members can get a free annual in-home visit from a licensed practitioner. We can also do that virtually, but oftentimes they are in-home. And that care is coordinated with the member's doctor. So the clinician will do a full medical history review with the member. They will update some labs and tests and do a physical exam. And that helps them identify any health risks or even care opportunities, and then give personalized education to that member so they can really stay on top of their care. And one of the other things I love is that the clinician, because they're spending that full hour with a member, they can identify other needs that might go unnoticed. Things like transportation services for help getting to a doctor's appointment or help getting healthy food.
Wow, that is so great. And now this is a big one, I know. How can we save money on prescription drug costs?
Yeah, that's always a big one. Saving money on prescription drugs can be a great way overall to really help manage expenses. Medicare Advantage plans, as I mentioned, do typically have Part D bundled with them. And the first thing I suggest to people is to look at their home delivery pharmacy options. Many plans will offer 90-day refills at a lower cost than getting those same drugs at a retail location. So that's a great way to start. In United Healthcare, Medicare Advantage members can usually pay $0 for Tier 1 and Tier 2 drugs if they order them from our Optum Rx home delivery pharmacy. Another great way is to talk to your doctor about lower cost options. Many expensive medications might be available in a generic form, which is lower cost, or on a lower tier of the formulary. So it's a great thing to talk to your doctor about. And then finally, I'd say ask about any special programs your plan has. For example, this year, United Healthcare offered broad access to our Medicare Advantage and our Part D plans, or covered insulin, limiting the out-of-pocket cost to $35 per prescription. So that's a savings of about $450 a year on average.
Wow, that is incredible. And Mary, where can we find additional resources to help us stay healthy and save money?
Members can always call the number on the back of their ID card. They can talk to their agent, or United Healthcare members can go to our website at uhcmedicarehealthplans.com.
Fantastic, Mary. Thank you so much for talking with me today. I really appreciate it.
Thanks for having me.